A few words about different myths that I hear all the time, and people ask these questions. One of them I already mentioned, that it is not an experimental vaccine. It is an authorized vaccine. The most people are concerned when I talk to them, and I know a lot of people who already vaccinated, a lot of people who want to be vaccinated, and a lot of people, maybe I shouldn't say a lot, but some people who don't want to be vaccinated. And when I ask them why, one of the reasons they say, oh, it was so quickly developed, I don't believe that it was everything done was properly. And it is not exactly true. If you are not aware of the entire vaccine development process, you may believe this. But once you know the details of this entire process, you will understand that there was no corners cut here. The process was accelerated for many, many different reasons, and I am listing here only few reasons. One of the reasons was that, first of all, we got the sequence of the virus really quickly because our genetic technology is so much better these days than it was even 5 years ago, much less 20 or 30 years ago. And then remember, our government paid companies upfront billions of dollars so that they develop vaccines. So the companies were not having this fear of spending billions of dollars and then nobody needs the vaccine. So there was a huge, tremendous financial incentive for companies to quickly develop those vaccines. And government threw a lot of resources into this as well. And then there are several steps in the vaccine development, and because it was such a huge emergency on the global scale, some steps were done in a parallel fashion, not one after another, but in parallel. And that also shortened the period. Also, it is important to understand that this is not a completely new technology. It wasn't invented in February of 2020. That technology already existed for several years, and the vaccines with similar idea of mRNA already developed and used, for example, successfully against Ebola, for example. So there was no new technology, that already was known technology. And then technology itself, mRNA technology, is not the same as you do with for example, flu vaccine, where you have to wait for weeks to process the product with eggs. This is much quicker. It's literally days and weeks instead of months to develop vaccine using this technology.